Welcome to the Motor Vehicle Safety Best Practices Overview. This is brought to you by the Colorado Violence and Injury Prevention Program of Excellence Guidance for 2014. The Colorado Department of Public Health and Environment has created the Program of Excellence Initiative in order to recognize those injury prevention programs that are implementing best practices and evidence-based initiatives across the state. In today's presentation, we are going to start with the state-level priorities for motor vehicle safety and then address the best practice strategies that can be implemented at the local level. We're also going to go through resources for motor vehicle safety and how to stay in touch with CDPHE and the Winnable Battle Initiative. Lastly, we'll go over how we know what works in motor vehicle safety and what it means to work on policy initiatives when you work in public health. Many of you may already be aware of those two issues, and so we wanted to leave them at the end for those who might need to learn a little bit more about the evidence base behind policy initiatives and motor vehicle safety. So let's start with the state-level priorities. Motor vehicle safety is a priority for the state of Colorado. The following lists a variety of programs, initiatives, funding streams, and groups that have recognized motor vehicle safety as an issue for Colorado. The last two we'd like to highlight. It was named a CDC Winnable Battle in 2011, and when in 2012 Colorado created its own 10 Winnable Battles, motor vehicle safety was highlighted as a priority once again. There are two primary task forces addressing motor vehicle safety in the state of Colorado. The first being the Colorado Teen Driving Alliance, which was formed after the passage of strengthened graduated driver's licensing laws, and the Interagency Task Force on Drunk Driving, which is a task force written into statute to address impaired driving. So what are the state priorities? Increasing seatbelt use and changing policies. We do know that seatbelts reduce fatal or serious injury by about 50%. And that Colorado seatbelt use would increase by about 8% if a primary seatbelt law were to be passed in this state. Impaired driving is another area of priority. In the state of Colorado, we do have zero tolerance for drivers under age 21, and with the recent passage of recreational marijuana for adult use, marijuana-impaired driving education and enforcement is a new priority. And lastly, strengthening graduated driver's licensing policies. More than 20 studies have found GDL to be effective at reducing teen motor vehicle fatalities, and research suggests that the most comprehensive of GDL laws can reduce fatal crashes by approximately 40%. Other motor vehicle safety priorities do exist in Colorado. Speed reduction, distracted driving prevention, child passenger safety, pedestrian safety, and bicycle safety are just a few. So what does it mean to implement best practice strategies at the local level? What we know to be true of effective programs are that they, number one, provide infrastructure and support to staff to do the work. Unfunded programs who do not have staff with dedicated time focused on their initiatives are not likely to be successful or have sustainability long term. Number two, effective programs use and collect quality local data to drive priorities. CDPHE has a long list of data that we can provide to you to help inform your programs. Number three, coalitions or local partnership support. Most of us cannot implement successful programs in isolation of other initiatives occurring within the community. So many injury issues are multidimensional, and implementing one aspect of injury prevention may also have a domino effect in other areas. Number four, effective programs implement evidence-based or best practice interventions or strategies. And we'll explain that just a little bit more in a moment. And number five, you include an evaluation plan to know whether or not you're reaching your goals and if your targeted initiatives and strategies are having the effect that you believe they are. So number four, implementing evidence-based and best practice interventions. What does that even mean? What we know to be true is that advocacy to improve policies or systems that promote safe driving are very effective. What we do know is that advocacy to improve policies or systems that promote safe driving are very effective. And this doesn't just mean changing laws at the state or at the local level. Changing company-wide policies on seatbelt use can also be a successful intervention. So now that you've seen the five-part structure of what it means to have an effective injury prevention program, let's look a little bit more deeply at what it means to implement evidence-based and best practice interventions for motor vehicle. So what does it mean? It means advocating to improve the policies or systems that promote safe driving. And when we say policy, we like to refer to it as having a big P or a little p. It doesn't just mean changing the policies at the state or at the local level, changing those laws. It can mean changing policies within an organization, like a seatbelt policy while employees are driving on the job. B. Support the enforcement of existing laws. Laws are only as effective as they are enforced because otherwise the public doesn't know or doesn't recognize that they need to follow the law. So supporting seatbelt or impaired driving enforcement time periods or enforcing graduated driver's licensing outside of local high schools are one way to implement that extra enforcement. And C, community education efforts with appropriate dosing. And what do we mean by appropriate dosing? Educational efforts are not proven to be effective when they occur only one time. What we know to be true of the human brain and learning is that we need repeat of the content and the information over time so that we have been exposed to the same information repeatedly and have a sufficient knowledge base to be able to begin changing behavior. So what can community education efforts include? You can educate the public about the current laws. Most parents, as we've seen in recent surveys, are not aware of graduated driver's licensing laws. Many people aren't aware of the seatbelt laws and how they changed in different age groups. Child passenger safety is another area for education within the community. Impaired driving, specifically when it comes to marijuana, is a significant education need for Colorado, and cell phone use is also important, particularly among teens. You can also educate your community about best safety practices that may be stronger than the laws. For instance, we know that curfews starting at 10 p.m. are more effective for teen drivers who are first learning the rules of the road than a midnight curfew. Currently, Colorado's curfew is set at midnight, so you can work with parents to inform them and educate them repeatedly and over time about the effectiveness of a 10 p.m. curfew to reduce the likelihood of a fatal crash. And lastly, you need to target the right audience to influence behaviors. For example, parents. Since we know that enforcement of graduated driver's licensing laws can be difficult since officers may not be able to recognize the exact age of a teen driver, enforcement really does start at home. So if you target parents with your educational efforts, they can help improve graduated driver's licensing enforcement before the teen ever leaves the house. On this slide, we've provided some sample objectives of what your program could implement at the local level that would be aligned with best practices. A, to increase the levels of coordination or collaboration that supports the implementation of evidence-based programmatic and policy strategies. B, increase local support for strengthening Colorado's motor vehicle safety policies. And again, that can be organizational or statewide. C, law enforcement officers will report increased knowledge and willingness to issue citations for current motor vehicle safety laws. D, drivers or parents will report increased knowledge, awareness, and motivation to comply with the existing laws, such as seatbelt or impaired driving laws. E, reduce the incidence of whatever risky behavior you are hoping to prevent. In order to help you better understand these sample objectives, we're going to show you an example action plan that CDPHE has used with its maternal child health funded local communities that are addressing teen motor vehicle safety. The following maternal child health local action plan follows those sample objectives that we just reviewed in the last slide. On the first page of the action plan, you'll see some context and some data about why teen motor vehicle issues would be addressed by a local community. The second page includes goals that a local community may want to address. The examples here, to align with maternal child health priorities, are to reduce the rate of crashes caused by teen drivers, reduce the rate of teen motor vehicle fatalities, reduce the rate of teen motor vehicle hospitalizations, and also teen motor vehicle emergency department visits. All of this data is available through CDPHE to identify at your local level, and it's available through the CDOT Problem Identification Report. From there, this local action plan is broken down into different objectives, strategies, and key activities that are outlined in order to reach those strategies, and strategies that are meant to help achieve the objective. There are target completion dates for each activity, responsible parties, and then also a monitoring plan. How will you know if you've achieved or completed the activity as outlined to the left? With each objective that follows, there are new strategies and new activities outlined. So now that you have a little bit more context of what a local action plan may look like as far as structure goes, let's talk a bit more about the types of activities that you may implement to achieve each of the sample objectives that we talked about earlier. So A, increasing the levels of coordination and collaboration to support the implementation of evidence-based programmatic and policy strategies. Some of those activities may include building, maintaining, or joining some other local level multidisciplinary motor vehicle safety coalition. Coalitions often function best when they operate using a team charter that outlines roles and responsibilities. You may want to create an action plan specific to the coalition of what are your goals and objectives as a group, and what activities are you each responsible for in order to achieve those objectives. Here at CDPHE, we often use our action plan internally and build in our coalition's activities into our own action plan so that they're all together in one document. Additionally, you would want to conduct and analyze baseline and annual collaboration surveys. If your objective is to increase collaboration coordination, then you need to know where you start and how you are progressing over time. The second objective we're going to look at is to increase local support for strengthening Colorado's motor vehicle safety policies. And again, that can be organizational or statewide laws. Some of those activities include conducting a baseline survey to assess each member of your coalition's support for whatever policy initiative you have identified. Completing a stakeholder log, which will outline all of the various stakeholders that need to be involved in the policy that you are looking to pass. Stakeholder analysis is a process of analyzing where each stakeholder is on the spectrum of support for your policy initiative. You may want to conduct key informant interviews to learn more about the nuances of why someone does or may not support your policy initiatives. Additionally, you may want to get your local health department executive director or some other well-recognized local agency to sign on to support Colorado's injury prevention winnable battle. When you have support at a higher level that this is an issue in your area, then you can use that as a rallying cry for more partners. Participating in policy trainings helps demystify the process of passing or supporting a policy initiative and will really help your stakeholders know what role they can play in that process. Be sure that you are using local motor vehicle data to demonstrate why this is an issue for your community, not other communities around the state, and educate your stakeholders about that data. Objective C, law enforcement officers will report increased knowledge and willingness to issue citations for current motor vehicle safety laws. Here's a list of some of the activities you may want to implement under Objective C. First of all, conduct a baseline survey of your local law enforcement officers to assess their understanding of your policy initiative, whatever that may be, and their willingness to enforce it. Educate them about the enforcement of that policy. Distribute cheat sheet cards that can help them understand the coding and fines that are permitted for an offense around that law. Conduct follow-up surveys with law enforcement to see if their level of understanding or willingness to enforce the law has changed over time. And lastly, encourage your local law enforcement to do increased enforcement of the policy initiative, whether that's graduated driver's licensing enforcement near schools or increased distracted or impaired driving enforcement initiatives. On this slide, you'll see an example of the cheat sheet card that was distributed to local law enforcement to enforce the graduated driver's licensing laws. As you can see, there are many different statutes and code numbers, as well as fines and types of violations for each aspect of graduated driver's licensing laws. In order to demystify that a bit and make it easier for law enforcement to include the appropriate penalty and fine, we created these cheat sheet cards for them to keep in their pockets. And Objective D, drivers or parents or whoever your target audience is will report increased knowledge, awareness, and motivation to comply with the existing law. This is an example of the parent brochure that was created in order to educate on the graduated driver's licensing laws. As you can see, it's a very complicated process depending on what age the teen is when they first get their permit. Using information like what is found in the brochure, here are some activities that you can do under Objective D. Conduct classes that help your target group understand the law, whichever one you're working to enforce, and how to best enforce it just at home. Recruit people to participate in the classes. Conduct pre, post, and post-post or follow-up surveys to assess any increases in knowledge, awareness, and motivation to comply with the laws. You can also distribute brochures at classes and through your local DMV. And lastly, be sure that you're using your resources well. CDOT has materials that are available for you, and also you can partner with schools or other local community groups to educate your target group. But remember, any education about the current laws has to have the appropriate dosing. A one-time event just doesn't cut it. And E, reduce the incidence of impaired, distracted, unrestrained, or whatever other risky behavior you're trying to prevent. Some activities or examples include distributing educational materials, conducting comprehensive evidence-based programs, doing surveys in order to assess changes over time, and applying for funding to support your activities specific to that one issue. This may sound a lot like what we've covered in the other areas, and that's because it is. You want to make sure that you're educating people, increasing enforcement, distributing the right materials, making sure that you have data about the effectiveness of your work. Now let's take an opportunity to go through some of the resources that can help you address those sample objectives that we just covered. You can use existing coalitions to leverage your efforts, or other local health departments to identify what activities they are implementing in order to supplement your own. Additionally, use the CO Teen Driver or the Teen Driving Alliance CO websites, which we will overview in just a moment. You can also go to the Interagency Task Force on Drunk Driving for more information about impaired driving initiatives around the state, or Car Seats Colorado to find out more about child passenger safety. The Colorado Teen Driving Alliance, as mentioned earlier, is a group of motor vehicle safety stakeholders that came together after Colorado's graduated driver's licensing laws were strengthened in 2005. On this website, which is teendrivingallianceco.com, you will find a variety of resources targeted at motor vehicle partners. First of all, the homepage is a blog that you can sign up to receive notifications of all emerging issues. For example, there's new funding available for communities to implement motor vehicle safety initiatives. Additionally, under the resources section, we have a variety of resources that are targeted exactly at the sample local action plan that was created for maternal child health partners. Again, this sample action plan is specific to teen motor vehicle issues. However, you can adapt and change it to meet your target issue as desired. So here you can find the sample action plan, example logic models for you to use, a sample team charter, a sample coalition effectiveness inventory. You can find parent surveys. You can find information on the parent survey that the results that CDPHE found when we conducted a statewide analysis. There's the stakeholder identification tool, stakeholder analysis tool, sample commitment statement for the motor vehicle winnable battle, and hopefully as I'm talking through this, some of these resources are sounding familiar as many of them echo the activities that we just went over in the example activities. This website will be a great resource for you to access. Additionally, there is one resource that I'd like to highlight here, which is the parent course. CDPHE and its partners created new materials to be able to distribute to parents and educate them about graduated driver's licensing laws. This approximately 45-minute online course, which first walks parents through the graduated driver's licensing laws, then how to teach their teen to drive, and finally creating a parent-teen driving contract, is a great resource to supplement your educational activities. Like we said, one-shot educational opportunities are not effective at changing behavior. Therefore, if you can send parents to this course as an ongoing resource that can supplement your in-person parent education course, that's a great way to get at the appropriate dosing for parent education. Additionally, you can use the resources from coteendriver.com. Most of the promotional materials that are put out through the Teen Driving Alliance actually include this website. The Teen Driving Alliance website was created just to be a resource to the partners that participate in community education. However, it is not the resource that we drive the general public to. If you go to the CO Teen Driver website, which is intended for the general public, you will find a safety advocates section. Here you can download all of the resources targeting teens, educational materials for schools, articles, web banners, how to involve parents, how to involve law enforcement, including videos that you can show at their morning meetings, and more. Here, under the Safety Advocates resources, you can find more information about coalition building and coalition assessment, as well as grant opportunities and more. Other stakeholders in Colorado for motor vehicle safety, such as MAD, have many resources of their own. They can help with presentations, with banners, with brochures, and with educational opportunities for your community. In order to leverage more funding for the great work that you are doing for motor vehicle safety, consider applying for some of the additional funding that is available through CDOT's Occupant Protection or mini grants, CDPHE's Emergency Medical and Trauma Provider grants under their injury prevention priority, through local or national insurance companies or local foundations and businesses, and also you can use NACHO's, which is the National Association of City and County Health Officials, their funding opportunity page for injury prevention priorities. Other online resources that may be of interest to you include the National Highway and Transportation Safety Administration's Countermeasures That Work. This document outlines the evidence for each of the strategies that are effective at reducing motor vehicle crashes, injuries, and fatalities. CDC's Parents Are the Key provides resources for targeting parents for at-home enforcement of graduated driver's licensing laws. The Insurance Institute for Highway Safety has a host of resources on effective motor vehicle safety interventions, as does the Governor's Highway Safety Administration. Additionally, you can use these online injury prevention training modules to supplement your learning about effective injury prevention and public health interventions for motor vehicle safety. Lastly, let's help identify some ways that you can stay in touch with CDPHE and the Winnable battle efforts. Access resources on the Safety Advocates page from coteendriver.com. Additionally, utilize the resources from the Teen Driving Alliance that we showed you. There are policy trainings available both in person and through webinars through many of those organizations such as the World Health Organization, NACCHO, or Safe States Alliance. Often CDPHE conducts webinars or conference calls to be able to relay more information about the resources that are available to you, our data products, or other evidence-based interventions that are occurring around the state. You can always contact us for one-on-one technical assistance to help identify some areas of growth or problem solve some issues that you are encountering in your local community. And then this July of 2014, we are hoping to implement a motor vehicle policy conference, and we hope you're there to participate. Please contact me, Allie Maffey, the Policy and Communication Coordinator at CDPHE, or Emily Wilfong, the Communications Manager for Safety Programs at CDOT, if you have any questions about implementing effective programming. Now, for those of you who may already be familiar with what works in motor vehicle safety, I thank you for listening this far in the presentation. Now, for those of you who may be new to this type of work or who may not understand the full scope of the issue in the state, let's go over both the data and the resources that demonstrate the evidence base for using policy interventions for motor vehicle safety. In the state of Colorado, motor vehicle crashes are one of the leading causes of death. If you look across the green areas, for nearly every age group, it is in the top 4 causes of death. Because this type of data rings true in most states around the nation, the CDC began to outline best practices for motor vehicle safety. The 3 domains that they outlined were the road infrastructure, the design of the vehicles, and the behaviors that the people engage in. So let's focus on people. There are high-risk groups that you can target, safety devices that you can encourage to be used, such as motorcycle helmets, risk factors that you can help reduce, or the policies that you can change in order to improve the safety behaviors that are engaged in by the public. The National Highway Transportation Safety Administration's Countermeasures That Work provides an excellent overview of the evidence behind each of the strategies that are recommended to reduce a variety of risk behaviors or to change policies to improve motor vehicle safety. Additionally, the Community Guide provides an overview of the types of interventions that are recommended or may have insufficient evidence for implementation to address a certain issue. This example is child passenger safety, but they also have information on seatbelts. So to summarize, for motor vehicle safety, the most effective intervention. So what the research supports and we know to be true for motor vehicle safety include these effective interventions: encouraging seatbelt use and changing policies to increase the likelihood of compliance. Strong impaired driving policies to prevent people from getting on the roads when they are unfit to drive. And strong graduated driver's licensing policies to keep teens safe on the road. Some of the graduated driver's licensing best practice recommendations include raising the permit age to 16 for all teens. Currently, teens can receive a permit at age 15 if they attend the appropriate courses. Raise the driver's license age to 17 and expand the nighttime driving restrictions to 10 p.m. to 5 p.m. instead of midnight as it currently is in Colorado. Strong policies like this have been effective at reducing motor vehicle fatalities over time. Here's just an example from graduated driver's licensing. When the laws were strengthened in the 2004 legislative session and went into place for 2005, you can see the drastic reduction in teen motor vehicle fatalities over time. Looking at effective interventions to increase seatbelt use, primary seatbelt legislation is one of the most effective and most highly recommended policy changes. Looking at the average rate of seatbelt use, you can see that the rate is significantly higher in states with primary law than those states with secondary law, both across genders and across age groups. As I mentioned at the beginning of this presentation, primary seatbelt legislation is a priority for many of the groups, coalitions, and funding streams in Colorado. And why is that so? Because increasing seatbelt use is the single most effective way to save lives and reduce injuries from motor vehicle crashes. Beyond that, Colorado's seatbelt laws are very confusing. It already is a primary restraint law for children 0 to 15, and it's primary restraint law for teen drivers and their passengers under 18. But where we fail are the 16 and 17-year-olds that are riding in a vehicle with an adult driver. They are only subject to the secondary law, and then all adults over 18 are also under secondary law. States with primary seatbelt laws do have higher seatbelt use rates for all ages, including that 0 to 15, because when the adults are more likely to buckle up, so are their children. And many of you may be asking, but what is my role as a public health employee or some other agency in changing policies? Public health departments' roles include assessing and analyzing policies for their effectiveness to be able to achieve the outcomes that they say that they will. For example, many states are proposing policies to decrease motor vehicle crashes that when you look at the National Highway Transportation Safety Administration's countermeasures that work, there is no evidence that supports the efficacy of those policies to reduce crashes. Public health can also convene interested groups to develop a plan for establishing policy strategies. Additionally, public health's expertise is often in data and the science to educate decision makers about the components and potential effects of policies. Public health often increases the public awareness of existing policies or laws and helps to evaluate the impact of those policies over time. And like I've been saying throughout this presentation, there are different types and levels of policies. There are organizational policies, and you can see those examples there. There are regulatory policies at the state and federal level, and there are also legislative policies at the local, state, and federal level. There are a few small communities within the state of Colorado that do have primary seatbelt legislation, but just for their municipality or county, not across the state. The Directors of Health Promotion and Education and the University of North Carolina's Gilling School of Global Public Health have identified these 5 domains within the policy process. The first is to identify a problem. How do you analyze the data and how do you communicate the issue to the public? Second, policy analysis. Third, promoting the solution. Fourth, implementing the solution as it was intended. And fifth, evaluating the effectiveness. This process is not always linear. Oftentimes, we step back from one stage to the next, but in general, you can see that from problem identification, it informs the policies that we develop, the policies that we promote, how we implement those, and how we evaluate those. And from that data, we identify new problems. Though you may not be involved in changing laws across the state or even at your local level, these stages still ring true for organizational policy change. Think about which stage your community is currently in your priority issue, such as child passenger safety. Is it an issue of implementation in your area and enforcement? Is it evaluating whether or not people are actually using seatbelts as intended? Are there new problems emerging that aren't covered under the current law? All of these can be true no matter what your priority issue is and no matter what type of policy, organizational or law, you are addressing. So now let's summarize. The state priorities for motor vehicle safety in Colorado include increasing seatbelt use and supporting policies do so, enforcing impaired driving policies, and strengthening graduated driver's licensing. And all of this can include simply the encouragement of enforcement as the policies are currently written and educating the public to adhere to those policies at home. It doesn't always require advocating for policy change, though you may find an appropriate place to do so, either at the organizational or law level. And let's review one more time what it means to implement effective program. It means that your program provides infrastructure and support to staff to be able to do the work that will reduce injury in your area. It means that you use and collect quality local data to drive your priorities. Your work exists within a coalition or has significant local partnership support. You implement evidence-based and best practice interventions, and you evaluate your work to see whether or not you are achieving the outcomes you intend. And implementing evidence-based and best practice interventions, what does that mean again? It means advocating to improve the policies or systems that promote safe driving in your area, supporting the enforcement of the laws as they exist, community education with appropriate dosing. Remember, one-time education efforts are not sufficient, but you will educate your community about the current laws, about best safety practices, and you will target the right audience that will influence the behavior. Thank you so much for participating in today's Motor Vehicle Safety Best Practices Overview. We hope that your program qualifies as a Colorado Violence and Injury Prevention Program of Excellence in 2014. We look forward to hearing from you.